Our most high God in heaven, we thank you for such a special day. We commit all the inauguration and the commissioning into your holy hands. We pray for traveling mercies for all those who are yet to join us. May your peace be with us till the end of the program. In the mighty name of Jesus, we pray. Amen.
We invite the Vice Chancellor, Professor Lydia Ziato, to give the opening remarks. Let's put our hands together for her.
Thank you very much, Mr. MC. Good afternoon to all of us. Oh, good afternoon to all of us. Good. It is my singular honor and privilege to welcome you all warmly to the University of Health and Allied Sciences today, the 29th of November, 2024. Today marks a very, very special day in the history of the university. And before I go any further, I am aware that somebody would introduce all distinguished guests here present. But to the members of the days, my Registrar Pro VC, the Director for Health Services for the Volta region, the President of GAPTRAM, and the distinguished scholars we are going to acknowledge today, I acknowledge you, and I acknowledge directors, students, and everybody else. 1 Corinthians chapter 3, verse 6, going, makes it clear that somebody plants, another waters, but it is only God that gives the increase. Today, we are here to celebrate two schools, or one school and an institute, or 2 units of the university. We are here to celebrate these schools and their strategic partners, and we are here to celebrate academics or members of the school and institutes that is helping the university to grow with the help of God. I must say that they themselves are aware that it's not their own might, but the giver of life that has brought us thus far. Why are we here today? We are here because the gown, the academic gown, has gone to the homes of individuals. It's not to town anymore, because the board, the game is going to be played in the homes, at workplaces, among friends and family members, and even enemies, if you think somebody is your enemy. Anyway, a few weeks back, I was pleasantly surprised when one of our own faculty member, Dr. Frank Obeng, came to my office with a, can somebody give me one game, one board? Mark James, can you give me one of them? Let's give me one. All right, so he came into my office with the game, and he came in with the Ludo thing and a book. And I said, oh, Doc, what are you holding? I said, VC, I'm coming so that we can play a game and learn. All right, so he had prostate cancer and he had breast cancer. So, okay, my research area is breast cancer, so I want to play the breast cancer. And so I started. Then he would go into the book and ask me a question. I could answer some. I could not answer all of it. And so where I got to where the snake, the head is, and I got the answer wrong, it brought me back. I said, oh, what is all this? I was aiming at the, what's the name? What's the name in English? The ladder. I was going to say actually. Anyway, I was aiming at the ladder, and I was asking him, so in case I was at 15, and the ladder is at 18. Can I go back or move forward? And he said, yes. If you play the number that you want to go back, you can go back. You want to move forward, you can move forward. But why I encourage him to bring this to the fore for the whole world to know what he has done is because most of the time as academics, when we do this work, we write our reports, we write our publication, that ends it. We don't make it known to the populace who are supposed to use the game or who are to use the products of our research. So we decided as a university to make the world aware that one of our own has been able to do this for how many, 7, 8, how many boards? 17 boards. Whew, that's a lot. So he has done it for, like I mentioned, cervical cancer, breast cancer, hypertension, diabetes, child malnutrition, sickle cell, breastfeeding, name it. Now, in addition to that, he also done some apps to go with it so that our children who are not board people, but they are computer people, can also equally learn. So we have the hard or the board copy for some people like us, and then we have the digital versions for some of them. Now, the work of a researcher demands funding. And so this opportunity is also to tell the world that researchers at Uhas, like our own Dr. Frank Obin, needs continued funding to do more so that he can bring knowledge to our people. In addition to that, today, at the same school, School of Medicine, almost 2 years back, the then head of department, almost 2 years, yes, Professor Ali Ayamba, came to me that he has drafted some letters that he had found some partners that are willing to support the university. So I should sign the letter. Or he signed the letter himself. I can't even remember. Whatever it is, there was a letter. So at the end of the day, one thing led to the other, and today we can boast of a research center. Now, I want to acknowledge the team from ECL Computing Limited. If you can rise to your feet, please. Please give them a hand. These beautiful ladies, can one of you join me? The leader of the team join me, please. Thank you. These beautiful ladies, please, you can have your seat. These beautiful ladies are representing their company, and they are going to be a lifelong partner of Uhas. Lifelong partner because after they helped us do what we are going to see this afternoon as the Clinical Research Center or the Research Center, they are also the team helping us to work on our website, and they have committed to continue to support us operationalize the center. So on behalf of the university, we want to thank you very much for your support, for your help, for everything that you are doing for us. Thank you. I call this strategic partnership. So I'm encouraging all departments, all schools to identify strategic partners that you can work with. And as a university, we'll give you all the support that you need. So that is School of Medicine. We are launching the efforts of our researchers to bring knowledge to the doorsteps of our own people. I told them that the questions are in English. I'm looking for an Akan version, an Ewe version, a Gan version, and others that our people who cannot read English can use. And that is also going to take money. The second reason why we are here is that about also 2 years, almost 2 years ago, our Institute of Traditional and Alternative Medicine, we have a dream to have a natural products testing center, a laboratory that can test with the requisite equipment, FDA accredited, that can research and test products, herbal products. And our director of the center, the current director, Professor Kwame Banga, worked very hard to win what we call the Student Lab Equipment Grant. The total cost of the grant, the equipment that we received, was about $94,000. In addition to that, before he joined Uhas, he had an ECOWAS grant that also had some equipment in there. And he brought this equipment to add to what we received from the US to furnish the laboratory. Professor Banga, are you there? Can you stand so that we acknowledge you? Anyway, I also want Professor Dr. Frank Obeng. Please, let's acknowledge you. He's the brain behind all these wonderful things we see on the table. And he's the brain behind the games that we have. Professor Ali Ayamba, can you be on your feet? Professor Ali Ayamba brought the marriage. He and his staff, I'm sure he will mention the people who helped, brought the marriage between Uhas and ECL Computing Limited. Prof, well done. So, the laboratory, the Natural Product Laboratory, to make it achieve the reason for which it was established, I started by saying that in 1 Corinthians 3, verse 6, somebody will sow the seed. So, Professor Wood, are you here? Can we see you on your feet, please? Professor Wood handed over to Professor Banga, and Professor Wood took over from Professor Bayo, or what's the name? Bayo. Professor Bayo, don't stay down. He's coming all the way from Kumasi. You can see the love he has for ITAM. And Professor, we are eternally grateful for sowing the seed, okay? So these two professors were the foundation of ITAM, and then Professor Banga took over. So Professor Banga worked very hard to get the grants and the equipment, and as management, we have supported this agenda. And together with strategic partnership with the School of Pharmacy and ITAM and FDA, our FDA Accra rep, where is the Accra FDA? Oh, you are here. Please be on your feet. Welcome, sir. I'll take your name later. Welcome. So they have helped us as a university to partner. That is why I mentioned the word strategic partnership. So FDA is helping us to certify, to make sure the lab is arranged in a way that they want. They want means that it will make the work possible. But you have the lab and you don't have the market. What do you do? Again, Professor Banga, together with his team, have made it possible for Uhas to have a strategic partnership with GAPTRAM. GAPTRAM President, are you with us? Yes, Professor Atu Duncan. Okay. Professor Bayo, Professor Atu Duncan. Professors anyway. We are very grateful that these partnerships happened, and because of this partnership, the lab can function because the partnership will mandate the need for the members of GAPTRAM to submit their products to Uhas lab, Natural Product Lab, for analysis. That said, what are my expectations for the two schools or institute school, whatever, my professors, my researchers, and to the university community? First, I want to commend the School of Medicine and the Institute of Traditional Alternative Medicine for what they have done. Second, I want to ask other faculty members, other deans, other HODs to emulate and do same or do better. We as a university, we are ready to support all of you to shine. In that same sense, maybe early next year, maybe before the year ends, another researcher will be here because he did an innovative, minimally invasive surgery for glaucoma, and will be here to unveil that one too, because it's a staff of Uhas who did it. And we'll also commission our dental clinic. We also have an imaging simulation center or lab to also commission, maybe early next year. We are saying that it's not only School of Medicine or like the imaging one, School of Allied Health Sciences, but all the other schools, all the other departments, identify a strategic partner and make a move. We are here to support you. The other thing I want to draw attention to is that, yes, ECL Computing Limited, you have helped us set up the center, but it is not complete. Can somebody else come and join the partnership? Because a research center needs some software for data analysis, software for running a lot of tests that as a research lab or center we need. We also need a lot of computers and other resources. If I say resources, research centers work with partners. So we need a video conferencing center or facility. We need stable internet and every other thing that can make a research center vibrant. In addition to that, we as a university, we do research from cradle to grave. So if you have an interest in something, come to our center, partner with us, give us the funding, and we'll do the work for you. Because we have all the disciplines within the health space in the university. Even though it was Prof. Ayamba and his team that brought this center, the center is for Uhas, okay? So they are not going to monopolize it. They are going to share the center with other researchers in the university. So you bring what you want to do. We are ready to partner with you and make it happen. Lastly, before I take my seat, I want to appreciate all GAPTRAM members here present. If you are here, can you be on your feet? Let us appreciate you, GAPTRAM members. Please be on your feet. Let us appreciate you, GAPTRAM members. On behalf of Management Council of the university, we appreciate your partnership. We are just commissioning a center, but look at the number that came. We thought only 2 or 3 people would come. We are so, so grateful for the partnership, and we assure you that we are going to do our part to make sure that you don't regret this marriage. Thank you. Please take your seats. So once again, you are welcome, and I wish us all a very, very enjoyable program. Thank you very much.
Thank you very much, Prof. Lydia Ziato, Vice Chancellor, Uhas. We'll call on Dr. Frank Obing, School of Medicine, to give a presentation on the board games. Let's put our hands together for him as he comes.
Thank you, sir. Good afternoon. Prof. VC, Professor Lydia Azayatu, Registrar, Pro VC, Regional Director, colleagues, and my teachers present here today. And all other dignitaries. Good afternoon once again. My name is Frank Obin. I'm a urologic surgeon, an academic, and a researcher. I give a short presentation on products, a package of products which are a crystallization of our research work. And this, the team that is behind all of the work you see. This is the outline of our presentation. As a clinician of a short practice of about 19 years, sitting in the consulting room, you realize that year in, year out, you are confronted with the same number of cases, similar ones, same numbers. It never goes down. You can remove all the prostate. Next year, you get some more to remove. You can do all the prostate biopsies. So whilst doing that, the popular upstream, downstream parable comes to mind, where there's this popular story of somebody downstream saving people being pushed into a river and drowning, doing very well at saving them and then rushing them to the hospital for them to be saved. But then somebody standing by helping him then asked the question, who keeps on pushing these kids into the river? We are very good at mopping the mess, but why not turn the tap off? So that brings us to Dal Green's Whitehead's Rainbow, which talks about determinants of health. This is a framework that tells us that the factors that affect the health of an individual are not just their constitutional makeup or their genetics, but family, societal, policy, and then even the larger environment all affect the person's health. So when, after becoming a urologist, I still found myself later on in a public health class. I was like, prostate cancer, where are you? So I looked at the determinants of prostate cancer as a disease, its severity, and its treatment outcomes. It was a retrospective analysis of 853 consecutive positive prostate cancer patients, biopsy positive, that had been treated fully in a cancer medical center in Accra over a 12-year period. The problem of prostate cancer can never be belaboured. In Ghana, it's the leading cancer, the leading cause of death. Case fatality rate about 55.2%, simply because most of our cases report very late to hospital, and therefore treatment outcomes are poor. There are wide equity gaps in terms of awareness, in terms of availability of treatment, in terms of accessibility to even metastasis screening. There is also the biomedical problem of PSA being not a perfect biomarker. So we set ourselves these general objectives and specific objectives. And we put together this conceptual framework, which looked at prostate cancer in the center being affected by the patient's biologic, genetic factors, age, etc., factors relating to their social, behavioral activities, alcohol intake, sedentary work, etc., social factors, as well as living conditions. And all of these eventually would lead to a prostate cancer with a particular risk or severity, risk stratum based on the D'Amico classification, ISUP classification, as the particular stage of diagnosis, a particular treatment outcome, and whether there will be toxicity. And this framework was an adaptation of somebody's work, Mamre et al. We reviewed a couple of literature, and we went through with our methodology, carried out the retrospective analysis. Our findings were stuck, and I share a few with you. Over the past 12 years, the trend of prostate cancer, based on our data, has been increasing steadily from 2009 through to 2023. And it's a cancer hospital, so all the cancers go there. And about 10% of the cases, we had 852, they had seen about 8,000 cases, so that makes about 10%. And this closely agrees with Globacon statistics. The trend also is different across different ethnicities. We have more amongst Akans than Eves and Gans based on the statistics. And the increase in trend was also not only in the diseases in general, but also in high-risk disease as well as metastatic disease. The numbers were going up. The mean age was around 67 years, median age also around 65 years, and this closely agreed with research by Cedi et al. The ethnic distribution, 55.52% of the cases were Akans versus 14.91% being Eves, and Gans had a little less percentage compared to that. So we also realized that the overall risk in terms of disease severity distribution favored more high risk, almost 44%, and then the rest of the 56% was distributed across low risk and then intermediate risk. Metastasis rate was about 20%, and the treatment response in terms of what we call 50% response by PSA, reduction in PSA, was about 50%. But if we looked at absolute response to treatment, which meant a very low PSA of about 0.5, sustained and not falling, then we had only about a treatment success of only 27%. And that was quite low and not encouraging. We also realized that certain factors like age, ethnicity, body mass index, socioeconomic status were significantly related to the disease risk itself, the metastasis risk itself, the treatment outcomes, and also toxicity. We managed to use computational intelligence using machine learning and then regression models, regression analysis, backwards stepwise regression analysis, to develop certain mathematical models that you see here, quite complicated. And it showed that when we combined multi-parameters, in addition to PSA, we got better detection rates than when we used PSA alone. And we have the Yieldings index, which is the decision point on the sensitivity specificity plots for both of the situations. We derived models for metastasis risk as well in newly diagnosed prostate cancer patients, and also models for toxicity and treatment response. At the end of the day, we realized that the trends suggest that there's an increasing number of prostate cancer cases in Ghana. There are disparities, ethnic disparities, physical demographic disparities, and BMI and then other physical demographic parameters did improve the ability of PSA in predicting prostate cancer risk and then the disease severity. We gave some recommendations, but we didn't leave the recommendations to others to look at. We decided to act on some of the recommendations. The recommendation in red, which suggested that innovative tools for health education and health promotion should be brought to bear. We took it up to ourselves, and also screening and metastasis detecting apps. We also took those upon ourselves. So post-study events, there's this seminal work done on malaria co-creation using a mosquito board game. This is how the mosquito board game looks like. It was done by M. Ofori-Boateng et al. In 2021. And M. Ofori-Boateng et al. Is actually on this research, and she's a part of the team that produced this board game. So we looked at her model, also looked at the socio-economic, the socio-ecological model, the social cognitive theory, which are quite similar to the Green Whitehead's frameworks, and then put together a modification of the game to suit prostate cancer. So the game uses interactive learning on the board, operant conditioning, vicarious learning, cues from people's significant others, and there's also positive reinforcement, negative reinforcement from when one has to be bitten by a snake. If they are able to answer a question, then they stay. Also, when one gets to the foot of the ladder and they have to climb, you don't just climb, you have to do some work before you climb. So you answer a question from the manual, which comes with the game, and then you are able to climb. So the hope is that whilst patrons go through this, learning takes place. And this is the product that we brought today to our university to be used in health promotional activities. It's also a research tool. Some of my students are going to work on it. I've been giving 2 students already from PA. One is working on it. When my medical students come, some certainly will work on it as well. So it's for training, it's for health promotion, it's for the family, it's also for implementation research. Actually, we didn't just produce this, we also tested it in a short pilot project, which was quasar experimental. We compared its efficacy compared to traditional methods of health education, like health talks, and we found that it was comparable and useful. And patrons were very happy and had an enjoyable learning experience. This is the field testing event. This is in one of the classrooms in phase 2, Uhas. After the data collection, this is the team. At the recently ended Uhas research, that paper was presented, and this is a picture depicting patrons visiting the poster. One of our professors from abroad visited us, and I was demonstrating the game to him. We've replicated the game into these diseases: breast cancer, cervical cancer, menstrual health, mental health, antimicrobial resistance, which are all very important topics. So that is the first tool that, Madam Prof. VC, we are presenting to you for the university to use in various activities. Then we decided that when God first put us on earth, we were called Stone-Aged men. One of the reasons was that we didn't have tools. The tools were mostly made from stones, and even cutting of meat was a difficulty. Later on, when we were able to produce tools that could cut meat, then survival and then nutrition, etc., improved. So we decided that we need to create tools. We are in a technological age. We need to create technological tools. So the models that I described, that we derived for prostate cancer risk, using the parameters that we identified to be very important, metastasis, toxicity, treatment, outcome, we used them to write codes in the R environment. I've been lucky to be introduced to the R computing, so I used it to write codes, which we ran in the R environment to produce apps. One app for prostate cancer screening, another one for metastasis detection amongst newly diagnosed prostate cancer patients, one for treatment response, and the last one for toxicity. So, Jefta, yes, some papers are going around. There are QR codes on them. You can scan them and go online and then interact with the apps. So this particular app was derived from one work from Kolebu Teaching Hospital on prostate cancer, which looked at PSA, alkaline phosphatase, etc. So this is the interface. Online, it looks nicer than this one. So I have a patient before me whose PSA is between 4 and 10. His disease is intermediate, high risk, alkaline phosphatase level selected, yes, almost. And then it's a locally advanced disease. So we input this into the app. Oh, I'm sorry. Okay. It's not projecting. ICT. Okay. All right. But please, on your phones, on any device that you have, you can go there and demonstrate. There's a QR code. You can scan from the screen as well. Okay. All right. So apart from prostate cancer, we were confronted along the line. In June, we had a child brought to us after circumcision with the scrotum virtually completely gone due to circumcision by a wanzam. A month later on, a child came with an amputated penile tip, also after a circumcision outside the hospital. When the postmaster rings, he rings twice. But there was a third ring when Professor Ali Ayamba saw a child with scrotal bends following Savlon being used to treat a circumcision wound. We thought we don't just have to sit down and look at that, but to do something about it. So we collected data, 5-year review of our circumcisions and their mishaps. And we came up with stark findings that made us realize that there are provider and demographic factors that predict the likelihood that a child may be at risk, a high risk of circumcision mishaps. And the age of the child, the educational level of the mother, the residence of the parents, the occupation, etc., were significant factors. So we used them as well in models and then produced apps. This map here shows the geospatial distribution of circumcisions and the circumcision mishaps. The red dots are circumcision mishaps, and the other dots represent circumcisions in general. So this informs how resources may be distributed when something has to be done about circumcision mishaps. This is the model we derived. Again, this was converted into an app that calculates the risk of a child having a circumcision mishap if nothing is done about it. The idea is that this will risk profile male infants, or even before they are born. Once an ultrasound scan is done and it is found that this is a baby boy that is going to be born, the app is applied, the neonatal age is applied, the mother's occupation, etc. are put in, and then it gives a calculation of a risk with a cutoff point, which tells us whether we need to pull the mother aside and counsel her and try and modify her thinking concerning where she's going to circumcise her child, or we don't. And through that, we hope that we would effect behavior change communication and eventually end up reducing circumcision mishaps in the Volta region. So that is the other two. Going back to where we came from, we started from a situation where we were sitting downstream and waiting for problems to come for us to deal with. Now we are moving upstream. We've moved upstream to look at what the cause of the problem is. We are going back upstream to effect or implement the tools that we've developed in educating the populace, also predicting and then detecting high-risk individuals and trying to mitigate the risk. That's risk reduction, and then eventually have effect reduction. So we've moved from operations research to translational research we are now at the level of implementation science. And we are sending applications to funding bodies. We've identified DIV, and we are sending an application for an implementation research on prostate cancer to improve early detection by applying the promotional tool and also the 4 apps, as well as other M-Health solutions in an implementation research, with the hope that in 5 to 10 years' time, we'll start having a gradual reduction in prostate cancer cases in the Volta region and later on to scale up. So thank you very much for your attention. We acknowledge Prof. VC, Prof. Frank Edwin, Registrar, Professor Margaret Japon. She's been very helpful directing my steps here and there. And then Ms. Elomlati helped with most of the posters that you see there. Mark James, we thank you as well. The team again, well done. You are very hardworking and then very resourceful. And then to our sponsors, Famanova, thank you very much.
Please let's put our hands together for him one more. We'll kindly call upon Dr. Crisanto Scubio, the Regional Director of Health Service, Volta, to give a brief remark. Let's put our hands together for him as he comes up.
Vice Chancellor of Uhas, distinguished members of the Governing Council and management of the University of Health and Allied Sciences, I'll observe the existing protocol and move ahead. Ladies and gentlemen, good afternoon. With a great honor and privilege, I stand here today to launch the Health Literacy Board Games and innovative digital tools developed by the esteemed faculty of the University of Health and Allied Sciences. This occasion marks an important breakthrough in our efforts to advance healthcare awareness and education. I extend my heartfelt gratitude to the Governing Council and management of Uhas for this remarkable initiative and for inviting me to participate. Health literacy is foundational to achieving better health outcomes. It empowers individuals, societies, to make informed decisions about their health. We bridge the knowledge gaps that often hinder effective disease prevention and management by simplifying complex health information and presenting it in engaging and interactive formats. Today, as we have been told, we unveil 17 health literacy board games addressing critical health issues such as prostate cancer, cervical cancer, breast cancer, hypertension, diabetes, child malnutrition, sickle cell disease, breastfeeding, just to mention a few of the 17. These tools are more than just games. They are a transformative medium for health education. They make learning about health accessible and enjoyable, fostering informed decision-making and healthier lifestyles. In addition, the introduction of machine learning and data analytics drive applications for prostate cancer, as we have been told by Dr. Frank, and the circumcision health, and the digital version of the prostate cancer board game represents a significant advancement in integrating technology with health education. These innovations demonstrate how modern technological solutions can address some of our society's most pressing health challenges. As we work towards achieving universal health coverage, initiatives like these are indispensable. They emphasize preventive healthcare and inspire behavioral changes, crucial for improving health outcomes. Moreover, they reinforce the idea that education should inform, engage, and empower. I commend the faculty and researchers who have invested their expertise, creativity, and time into developing these tools. Your dedication to addressing the health challenges of our time is both praiseworthy and inspiring. The impact of your work will resonate far beyond the confines of classrooms or workshops, touching lives across Ghana and beyond. I am pleased to launch the Health Literacy Board Games and digital tools officially. On behalf of the Volta Regional Health Directorate and the broader health community, I assure you of our full support in ensuring these tools reach the people who need them most. We are committed to working together to maximize their impact and to advance health literacy in our societies. Congratulations to the University of Health and Allied Sciences for this groundbreaking achievement. Let this moment inspire us all to innovate and collaborate for a healthier, more informed society. Thank you for the opportunity to be part of this remarkable journey. May these tools inspire optimism and progress in our shared mission to improve health outcomes for all. Thank you. Where is the prostate one? I'm at risk, so that I use that one. Okay, but that's okay. Oh, no, that's okay. That's okay, for want of time. So, the ladies may sit down by us. So, Frank, we can just go by this. So,
Should I give it?
Frank. All right. So, these board games are duly launched. Thank you very much.
Let's put our hands together for Dr. Kubi. Professor Ayamba Ali will give us a presentation on the Uhas Ecl Research Center. Let's put our hands together for him.
Good afternoon. Prof. VC, permit me to stand on the established protocol to do the presentation. Right. Today, I'm happy to be part of what we thought was not going to be possible. At least we've been able to bring it this far. And as VC said, somebody sows, another person waters, and the plan grew and keep growing. This is a collaboration between Uhas and ECL, Enterprise Computing Limited. There's no any other interest to disclose apart from research for a better health care. In 2022, I was appointed the head of surgery. And as part of the mandate, I was to promote research in the department. So initially, I did my SWOT analysis, and I realized that we had a lot of data that was wasted. And our patients were very eager to participate in any form of research. In fact, some of them will even go back to tell you that, oh, we had these labs 5 years ago, can I bring it to you, doctor? And I thought that something was missing. I looked at the output of the faculty in terms of publications, and we were less than the average for the school. The average for the school then was 0.9 papers per faculty per year, and we were far less than that. What was even more sad to me, or saddening to me, was many of these papers were in areas other areas and not surgery. And I thought that we had the responsibility to promote the subject and find solutions to the numerous problems our patients are facing. The basic things I saw or identified was that there was a need for a dedicated support system for the surgeons and other faculty to be able to promote this agenda. The main question was, where were we going to get funding, at least to start? And that is when ECL came in at the right time. There, it is an ISO certified. Probably I only know as ISO, which is supposed to be the standard. If you ask me anything further, I can't say anything. So let's keep it there. So they came in when we put our plea to them, and they were willing to assist us to realize the dream of establishing a center that will support everybody in the department, in the school, and beyond in terms of research. So we are very grateful. So the shared vision led to this, which we'll be commissioning very soon. So this is the workstation, 2 of them, which is currently in the center. We have an administration. We have a conference room, which is coming on your screen. And we have a clinical trial room and a cafeteria. So the vision for this center is to be a world-class center of excellence in biomedical research. We are starting with clinical research, and we'll upgrade it. That will drive transformative innovations that will improve health outcomes for our people and beyond. And our mission, in line with the mission of the university, is to be a preeminent research center committed to fostering a culture of research excellence. And by this, we will help equip researchers with cutting-edge resources, support capacity building, and facilitate impactful collaborations with other establishments that will generate solutions through their research to improve the lives of our sick brothers and sisters. Our work or core values that will guide us will hinge on excellence, striving to attain the highest standard in research, meaningful collaborations with other academics, industry, as an example like ECL and communities. And we will uphold ethical standards by ensuring transparency in all our activities. We will also make sure we promote all inclusiveness and operate this in a sustainable way such that it will grow and grow high. Now, our strategic goals are capacity building of faculty in areas of research methodologies, grant writing, and publications. And in this regard, we have been able to speak to Prof. MG, who is giving us support in that direction. We will continue resource mobilization by identifying establishments that can support us in that direction. And we will continue to develop the infrastructure there. What is shown is the basic. A lot is needed to realize the full dream of the center. And eventually, we want it to become a non-profit foundation that will support researchers in terms of resources in the area of biomedical research. As you saw earlier on, the facilities currently there is the conference room, the trial room, clinical trial room, which we are in the process of equipping it further. We have dedicated offices for projects, data management, and for the administration. Our area of focus will be infectious diseases and immunity. Global surgery with the various tracks in orthopedics, trauma and orthopedics, general surgery, urology, and all others. Clinical trials, health innovation, and health technology. The leadership there will support teams specializing in research strategy, their implementations, operations, and industry engagements. So we are opened for these opportunities of engagement in research programs, training, and the partnerships, as I mentioned earlier. I want to acknowledge management of the medical school and Department of Surgery, the dean, and everybody for the support we have received so far. But these individuals' contribution cannot go without unnoticed. Prof. Frank Edwin, the immediate past dean, who is now our pro-VC, he was supportive right from the beginning and still continue to support us when we have any challenges. Dr. Yotti, my co-conspirator for good things only. And the then school officer, Antonia Sempa, and Makafu, they were very helpful. The VC, the first time I went, I thought she would tell me that, oh, you go, let me think. But when I went, she was very, very welcoming and has been supportive from that day up to now. VC, thank you so much. Prof. MG, I've gone to her office twice. I'll be knocking more times. So be ready for me. Dr. Matilda Bresse Ako, we have had a number of interactions which has been very helpful in the journey. ECL, your team led by Sionelda, I'm very grateful. Okay. And as the VC mentioned earlier on, it's a marriage. So we'll be going along helping each other. So thank you very much. Thank you for listening.
Thank you very much, Professor Ali. We invite the rep from ECL to give a brief statement. Let's put our hands together for her as she comes up.
afternoon. I didn't know I'll be presenting or saying anything, but I have to. Okay, so I have to say something brief. Good afternoon again. So it is a privilege to join all of you today to launch the ECL, Uhas Clinical Research and Treatment Development Center. So at ECL, we are passionate about leveraging technology to advance healthcare delivery. Our support for Uhas in establishing this research facility reflects our dedication to social responsibility and community service. The medical equipment and other stationery that were presented were only to enhance vital research efforts. I would like to take a moment to acknowledge the support we had from the VC. So when we came, the first time we came to donate the items, we saw the VC herself coming around, and we thought that, wow, this is a very supportive environment where you have the leadership team coming down to even receive us, and we were very grateful to Prof. VC. I want to also acknowledge the Pro VC, that is Prof. Edwin, and the registrar, Madam Ya Amankwa Opuni, Dr. Maunyo, as well as Professor Ali Ayamba. Your leadership and commitment have made this collaboration a reality. We are committed to providing ongoing support and guidance to Uhas to explore innovative fields such as telemedicine, machine learning, robotics, and disease modeling together. We aim to create a future where quality healthcare becomes a reality for all. Thank you very much for having us, and we know this marriage will go a long way. Thank you.
Thank you very much, ECL. We'll call again on Dr. Chrysanthus Scubio to give a brief remark. Let's put our hands together for him, please.
The Vice Chancellor, distinguished guests, ladies and gentlemen. This morning, somebody made a mistake and referred to me as Prof. I didn't correct the person. I said maybe the person is praying for me to become a professor one day. But I started thinking about how difficult it becomes for somebody to be a professor. But once the person is praying for me, I'll also pray towards that. I find it an absolute privilege that on an occasion like this, with all the big professors, I'm given the opportunity to make remarks once again at the commissioning of the Uhas ECL Research Center. This transformative initiative holds immense promise for advancing research and healthcare in Ghana. The center, as we have been told, is evidence of power of vision, collaboration, and commitment. It is truly inspiring to see how the initial efforts of the Department of Surgery under the leadership of Professor Ayamba Ali and Oyotoye, I hope I pronounced the name well, have evolved into this comprehensive and well-equipped research hub, made possible through the generous support of Enterprise Computing Limited and the strategic foresight of Uhas management. The establishment of this center aligns with the urgent need to strengthen research capacity within our healthcare and academic institutions. The vision to drive innovation and transformative discoveries that advance healthcare in Ghana and beyond is timely and necessary. This center will play a key role in fostering excellence, collaboration, and inclusivity in research. By equipping researchers with cutting-edge tools and resources and cultivating partnerships with industry and academia, the center will undoubtedly make significant contributions towards addressing critical health challenges. I commend Uhas for integrating research into its academic fabric and adopting a sustainable approach through initiatives like the Non-Profit Foundation. These strategic steps will ensure that the center strives and remains impactful for generations to come. On behalf of the Volta Regional Health Directorate, I extend our firm support for this initiative. We are eager and expecting to see the breakthroughs and contributions this center will bring, and we look forward to its impact on healthcare delivery in the region and across the nation. Congratulations to Uhas, the School of Medicine, and Enterprise Computing Limited for this outstanding achievement. May this center be a shining example of innovation and collaboration, driving meaningful progress in biomedical research and healthcare. Thank you, and I wish the center great success in this mission.
So I think Dr. Santos has sealed the marriage between ECL and Uhas. We invite Professor Kwame Banga to give us a presentation on the ITAM lab. Let's put our hands together for him.
Professor Lydia Aziato, Vice Chancellor, Mrs. Ya Amankwa Opuni, Registrar, Professor Frank Edwin, Pro Vice Chancellor, Dr. Mark Amiyo, Council Member, representative of the India High Commissioner, Mrs. Agat Bita Angama, representing the Ambassador of the Republic of Cote d'Ivoire in Ghana. Are you here? Thank you. Dr. Angela Akon, representing the WHO rep, Ghana. I don't know if she was able to make it. Okay. The representative of the Traditional Medicine Directorate, Ministry of Health, TAMD, the representative of the Traditional Medicine Practice Council, Professor Samuel Ato Duncan, President of the Ghana Federation of Traditional Medicine Practitioners Association, Mr. Nana Kojo Obri, General Secretary, National General Secretary of GAFTRAM, Mr. Samuel Autu, Dr. Atuguba, the Regional Chair, GAFTRAM, executive members of GAFTRAM, and members of GAFTRAM, the representative of the Ghana Association of Medical Herbalists, Mr. Seth Sinyeke, I hope I pronounced it well, Deputy Chief Executive Officer, Food and Drug Authority, Mr. Dr. Abba Eklu, Director of the African Omnitherapeutic Center from Togo, all the way from Togo, with his spouse, Dr. Abba Eklu. No, yes, they are there. Please, can you stand up so that we can welcome you? They just came from Togo. Thank you. And the representative of the Volta Regional Council, Professor Marcel T. Bayo, Founding Director, ITAM. Professor Eric Woods, Immediate Past Acting Director, ITAM. Mr. Linus Ayikpo, Managing Director, MES Equipment Limited. Distinguished guests, ladies and gentlemen. So today is indeed the day that the Lord has made for ITAM and for Uhas. I'm very privileged and honored to stand here today. So I will briefly take you through the journey that took us to today's commissioning. So for those who are not aware, the University of Health and Allied Sciences was established in December 2011 by Act of Parliament with a mandate to create an institute of traditional and alternative medicine, which shows the importance that traditional medicine, the role that traditional medicine plays in our healthcare system. And this mandate was executed in September 2019, when ITAM was officially created and immediately started its activities under the leadership of Professor Marcel T. Bayo, who is the founding director, and we are very privileged to have him with us today. The vision that was assigned to the Institute is to be an internationally recognized center of excellence in the development and promotion of traditional and alternative medicine practices. And the mission is to optimize healthcare by facilitating the holistic integration of traditional and complementary medicine into the national healthcare system. And we want to do that through education and training, research and product development, advocacy and community engagement, and service delivery. So to achieve this vision, Professor Bayo and his team set up a strategic plan for ITAM, a 5-year strategic plan. I think it started in 2019, but it's mentioned 2020, 2024, which was developed together with the small team that he had. He was able to put up this strategic plan. And one of the key priorities that was identified in this strategic plan was the establishment of a lab for natural product testing and also for research and development. And this is because such a lab represents a critical step towards integrating traditional medicine into the national healthcare system. So the objectives that were set for this lab is to conduct rigorous analysis to meet regulatory standards in collaboration with the Food and Drug Authority. So this collaboration was very important. To facilitate the development of effective and safe natural remedies. To provide advanced training and research opportunities for students, for faculty, and for the practitioners. To partner with GAFTRA to support the growth and standardization of herbal products. And the final objective is also to offer commercial testing services to support Uhas' internally generated funds. So you understand that to achieve this vision, we cannot do it alone, ITAM as a small team. So I will take you through the implementing step that we took. So the first step was to establish a strong collaboration and partnership. So we started by the region. We are in Volta region. So we established a collaboration with the Volta Regional Council, and we had the opportunity to present this project to the regional minister, and he was so impressed and supportive that he called for a stakeholder meeting of all the agencies under the Volta Regional Council, Coordinating Council. We moved to the national level, and we established collaboration with the Traditional Medicine Directorate, Ministry of Health, and with GAFTRAM, our key stakeholders. And this collaboration with GAFTRAM led us to the signing of a memorandum of understanding, and that is what we are trying to build on. We also included the Ghana Association of Medical Herbalists and the Food and Drug Authority and the Association of Ghana Industry. We are here to sign an MOU with all these organizations. And I learned this morning that the Attorney General has approved the draft MOU that we have submitted to the Volta Regional Coordinating Council. So, Prof. Chair, very soon we'll be signing the MOU with the Volta Regional Council. Then, since our vision is to become internationally recognized, we moved to the international level. We established a collaboration with the Côte d'Ivoire Embassy in Ghana, who paid us a visit, and with the Indian High Commissioner, who is also very supportive and even visited Uhas and we're expecting him to be here today, but he had to travel. Then we went in the sub-region to Togo. So our Togo partners who are here invited us to Togo. They took almost everything in charge, and we had a very fruitful discussion, and we signed an MOU with this organization, which is the African Omni-Therapeutics Center, COA. It's not the COA, Prof. Duncan, they are also COA. So the second step, after establishing all this collaboration, was also to take bold steps. So we decided to secure funding and equipment. And by the grace of God, we were successful through the Seeding Lab Instrumental Access Program and through the ECOWAS Research and Innovation Support Program, which donated a whole container of equipment to ITAM, and we are very grateful to them. The third step, when we received these equipment, I don't know if some of you are familiar with Seeding Lab, but they donate second-hand equipment or brand new equipment. So we were privileged to receive both a mix of second-hand equipment and brand new equipment. So when the equipment were received, the challenge was to make sure that these equipments are functional. So we came in with the collaboration with MES Equipment Limited. Thank you very much. I'm becoming emotional, sorry. So they generously, oh, I don't know. Let me breathe.
Right, so our director is very, very excited, so let me help him. We had a three-bedroom apartment or flat at the Dave campus that you take a breath. Yeah, okay now. All right.
So I'm emotional because they offered the service free of charge. They tested the equipment before and after the installation. So then after that, we needed in the first step to find a facility that will host the equipment. And this is where we came back to our Vice Chancellor, and we were also she was also very supportive. She instructed work and physical development to find a place, a facility. So this is the facility, the three-bedroom facility that was identified by work and physical development. And as you can see, look at the state of the facility. When you see it, can you dream that it will become something else, if not by the grace of God? So after the renovation, this is what we are coming to commission today. And please, this was entirely funded by the University of Health and Allied Sciences. So the facilities that we have in this lab include a phytochemistry lab, a microbiology lab, a pharmacology and toxicology lab, a product formulation lab. That includes a storage and grinding room, a prep room, formulation room, labeling and packaging room, and an in-process quality assurance room. And also a sterilization room and other support areas such as changing room, staff and visitors' toilets, reception hall, and a manager's office. So yesterday we finished the installation thanks to MES Equipment Limited. So these are some of the state-of-art equipment that we have in the lab. So for those who are familiar, the faculty, the UHPLC, the purifier, the PCR, and the down right there is the grinding, semi-industrial grinding machine that we have received from ECOWAS. So my GAFTRA members, we are fully prepared to receive your product. Please. Okay, so we have done much, but we still have some needs. And I want to call for support. Please, we know you have supported us, but please let's complete the support. So we need a water distillation unit. You know that in the lab, we don't use the tap water. We need a distillation unit to produce the water that we use for the experiments. Then we use an animal housing facility. This is because the product that we are going to test, we can't test it in human being first. We have to test it in animals, on cells. So we need a small animal house facility and a zebrafish facility to test all these samples and make sure that they are safe and effective. And we also need a pickup vehicle to carry, transport, the raw material, the equipment, and the sample. In fact, I put it there, but it's more to transport the director and the staff. So in conclusion, before the acknowledgement, I want to say that the ITAM Natural Product Lab represents a significant milestone for Uhas and for ITAM. And it demonstrates the power of strategic planning, collaborative partnership, and dedication to innovation. And it is also a testament to the collective effort of all contributors, creating a legacy for future generations. Now, we are an institute of traditional, of alternative medicine, so we respect the tradition. I can't conclude my presentation without acknowledging the following individuals and organizations who have contributed to the success of this project. So in first place, of course, we have our mama, the Professor Lydia Zato, Professor 1, Vice Chancellor of the University of Health and Allied Sciences, for a visionary leadership for UAS and ITAM growth. Professor Frank Edwin, Pro Vice Chancellor. Should I say Miss or Mrs.? Which one do you prefer? Miss, okay. Miss Ya Amankwa Opuni, for their continuous support. So I think we will employ them in our institute, right? My staff. So, and in this project, they made sure that we secure a storage room for the equipment when they came. When the equipment came, we didn't know where to put it. It was a headache. Then I say, why am I worrying myself? Let me call Pro Vice Chancellor and registrar. So they will find a solution. So they secure the place for the equipment at the SBBS. So I also want to extend the gratitude to Professor Asma, the Dean of SBBS. And then our predecessors, Professor Bayo, funding director from 2019 to 2021. Then Professor T.C. Fletcher came in before the appointment of Professor Wood to oversee the institute. And Professor Wood came in as the acting director. And I added Professor Boaben because he's also very, very supportive. So this strategic partnership between the School of Pharmacy and ITAM is very important. So Prof. Boaben, I think we have to sign an MOU as well. And then to my team, the journey has not been easy. Okay, to my team, thank you very much for your support. To Work and Physical Development, Mrs. Ola, Director of Work and Physical Development, very supportive, and their team, I want to thank you. Procurement, Mr. Asante, the up and downs is not done. We are waiting for our capsule filler. Where is it? Okay, thank you. Audit, thank you very much for coming in. And then our former Public Affairs Director, very supportive. And then the new Asempa, Togbe, thank you for your support. Then make sure that ITAM is visible. And then ICT Director, my neighbor, is he around? Okay, Mr. Patrick De Souza, who is also very supportive. Then to the organization, you see, even though we are very young, look at all the collaboration we have already. Seeding Lab, Instrumental Access Program, ECOWAS, Food and Drug Authority, Volta Regional, Coordinating Council, WHO. It's not Center for Awareness, it's African Omni Therapeutic Center. And then the Ghana Federation of Traditional Medicine. I also added the Ghana Medical Association. And I want to thank GAFTRAM because at the last 25th anniversary of Traditional Medicine Week celebration and the 22nd African Traditional Medicine Day, UAS was featured. Professor Lydia Ziato was the guest speaker of this event. And we were even awarded, we received our very first award for our contribution to the promotion of traditional and alternative medicine. My name is Professor Banga. Thank you very much. God bless Ghana. God bless traditional medicine.
Let's put our hands together for him. We invite Professor Samuel Atodankan, National President of GAFTRAM, to give a brief remark.
Vice Chancellor of Uhas, management, faculty, and staff of Uhas, executives and members of GAPTRAM, distinguished guests, the media, ladies and gentlemen. The voice is not coming properly because I'm also as emotional as Prof. Banga was. Because, when we talk about traditional medicine, it is dear to some of us. Our very existence, and because of that, we become too emotional when there's anything like this. It is with great honor and enthusiasm that I stand before you today as we gather to celebrate a significant milestone, the unveiling of the new laboratory for research and development of natural products at the University of Health and Allied Sciences, Uhas. This moment marks a giant step forward in our collective pursuit of harnessing the immense potential of plant and alternative medicines. Today's occasion is not merely the unveiling of a physical structure, but the manifestation of a bold vision, the Green Gold Agenda, a vision that seeks to elevate plant and alternative medicines as high-value commodities for Ghana and beyond. The Green Gold Agenda seeks to harness the potential in traditional medicines, package them, standardize them, and give them an international outlook so that they become another commodity from Mother Ghana, which we call the Green Gold Agenda. And we believe that this will be another commodity that will bring Ghana's economic recovery back on track. At the Ghana Federation of Traditional Medicine Practitioners Associations, GAPTRAM, we firmly believe that this collaboration with Uhas is a transformative partnership. The Memorandum of Understanding we have signed represents a shared commitment to advancing research, enhancing the quality of plant medicine and alternative medicines, and ensuring that our products meet international standards. I'm happy that the FDA is also here and supporting such a worthy cause. And we believe that bringing our product to the international standards is the best way to enter into the international market for foreign exchange, to reduce, to bring down the rise of the dollar against the cedi. The cedi against the dollar. The importance of this new laboratory cannot be overstated. This state-of-art facility will facilitate rigorous research, enabling us to uncover the full medicinal potential of indigenous plants while ensuring safety and efficacy for users. Prof. Chair, as Ghana aspires to become a global player in plant and alternative medicines, this laboratory stands as a beacon of hope and opportunity. With enhanced research capabilities, we can meet international benchmarks and unlock access to export markets. This has the potential to generate substantial foreign exchange for Ghana strengthening our economy, and uplifting the livelihoods of many within the value chain. If you're able to do this, a lot of traditional medicine practitioners who cannot even try their products, even though they are very potent, will have the opportunity to test them and bring them onto the market as a marketable product. And I think that this is where we have to commend the Uhas for this great achievement. I commend Uhas again for its unwavering dedication to innovation and excellence. This partnership demonstrates the power of collaboration between academia and industry. Together, we are charting a new course, one that not only promotes health and well-being, but also positions Ghana as a leader in the global plant and alternative medicine industry. To the researchers, scientists, and traditional medicine practitioners, I urge you all to embrace this opportunity with vigor and commitment. Your work here is more than a career. It is a calling to pioneer solutions that benefit humanity and contribute to the sustainable development of our nation, Ghana. As we unveil this laboratory, let us remember that this is just the beginning. The road ahead will require continued collaboration, innovation, and a relentless pursuit of excellence. Together, we can ensure that plants and alternative medicines achieve their rightful places as a cornerstone of Ghana's healthcare, Ghana's health, economy, and global reputation. On behalf of GATRAM, I say what I can tell Uhas is that you have our full support for this initiative. We are proud to be part of this groundbreaking journey and remain committed to working hand in hand with Uhas to realize the full potential of plant and alternative medicines in Ghana. Before we came to the program, we went around and were introduced to lecture hall that is going to train our traditional medicine practitioners in various languages, Ewe, Akan, and English. This is the first time a university is giving such an opportunity for those who cannot use English to study. And this is going to go a long way to improve our traditional medicine practitioners in the country. We have a lot of people with very good qualities, but they need an enhanced skills to better their performance. And this is the way to go. Congratulations again to Uhas for this great work. Prof. Chair, finally, let me express my heartfelt gratitude to the leadership of the University of Health and Allied Sciences, the government, and all stakeholders who made this vision a reality. Your efforts will leave a legacy that future generations will be proud of. Thank you, and may this laboratory serve as a catalyst for groundbreaking discoveries, stronger partnership, and brighter future for all. Thank you very much.
Thank you very much, Prof. Duncan. We invite Mr. Seth Seniki, Deputy Chief Executive Officer, Health Products and Technology, Food and Drugs Authority, to give a brief remark.
Bonjour tout le monde. I heard we have some of our French compatriots around, so my French started coming up. So, Prof. VC, permit me to stand on the existing established protocols, because when Prof. Banga was standing here, the number of people that he recognized, I'm sure if I want to start, I will fail. So permit me to stand on the established protocols. I bring greetings from the Chief Executive of the Food and Drugs Authority, Dr. Delis Dakon, who had wanted to be here herself, but has been held up by other equally important assignments. The Food and Drugs Authority is very happy to be associated with this establishment of the laboratory at ITAM. The Food and Drugs Authority is very happy to be associated with Uhas, not only in this area, but in other areas. We believe that association and collaboration with universities, scientific organizations will go a long way to fulfill our mandate of ensuring that we have quality assured medical products, including alternate and natural products, and also monitor the safety of these products all the time. We want to say a big thank you to Uhas for inviting us. I remember how Prof. Bayo, I think in the year 2020, during the COVID time, visited our office with issues regarding establishment of a state-of-the-art laboratory for natural products. And I remember how we were very excited about that. We know that one of the challenges with respect to herbal medicinal products and other natural products is standardization. And it is our hope that this laboratory will not only serve Ghana, ECOWAS, or the rest of Africa, but will become so famous that it will even serve other continents as time goes on. So once again, we say congratulations to Uhas, congratulations to ITAM, and thank you for inviting us. Thank you.
We invite the rep from Farmanova to give us a 5-minute presentation. 5 minutes. Please, let's put our hands together for him as he comes up.
Good afternoon. Good afternoon once again. My name is Eugene Saba. I'm a pharmacist and medical representative of Farmanova and Atlantic Life Sciences. My territory is Volta and OT. So on behalf of my people, Miawizo, I'm here with the sales and marketing manager for Farmanova and Atlantic Life Sciences, Mr. Vishal, over there. And I wouldn't take too much of your time. I'm sure most of you are familiar with Farmanova and our basket of products. We were brought into incorporation in the year 2005 by Mr. Dhananjay Tripathi. He's Indian, but he's currently a naturalized Ghanaian. So our business is considered a Ghana-made business. We provide employment for about 650 Ghanaians. We are compliant to the current good manufacturing practices. And 18 years later, Atlantic Life Sciences was brought into incorporation. Now, the difference between both companies is Farmanova handles tablets, suspension syrups, suppositories. Atlantic Life Sciences handles the sterile products, infusions, anesthetics, eye drops, small and large volume parenterals. Now, Farmanova was the first company to start suppository production in Ghana, first company to come out with friendly wallet packs of artemether lumefantrine, the first company to combine hydrochlorothiazide with the antihypertensives. Now, the main reason why I'm here is to discuss 3 products of ours. There are 3 powerful antibiotics, ceftriaxone plus sulbactam meropenem and levofloxacin. Now, ceftriaxone, sulbactam, and meropenem are considered beta-lactam antibiotics. I'll quickly go through them, so I'm sure most of you are aware of them anyway. Ceftriaxone inhibits the formation of the cell wall of bacteria by binding to penicillin-binding proteins. And in doing so, the synthesis of the peptidoglycan wall is inhibited, thus making the bacteria die. That's how it exerts its bactericidal effect. However, as powerful as ceftriaxone is indicated for a lot of bacterial infections. As powerful as it is, as recent as 2017, it was observed that there was resistance being developed, 50% resistance, meaning for every two cases you treat ceftriaxone with, you are likely to experience resistance in one of those patients, which is quite alarming for the power it carries. Now, how do we solve that issue? We can't discard ceftriaxone just like that. We need to find a way to keep it working. So we combined it with a beta-lactamase inhibitor. Now, the bacteria carries beta-lactam, and beta-lactamase. The beta-lactamase hydrolyzes the beta-lactam ring on the ceftriaxone. So the beta-lactamase inhibitor prevents the beta-lactamase from destroying the beta-lactam ring on the ceftriaxone, so the ceftriaxone can work in circulation just as. The ceftriaxone has no direct therapeutic effect on the patient. Now, this product is being made in Ghana, as I said. So it's affordable, it works just like your plain ceftriaxone. There are studies that show that it being used compared to plain ceftriaxone will give you more higher susceptibility zones than just the plain ceftriaxone. It's, if you have any allergies to any beta-lactam antibiotics such as penicillins, it should be avoided. The next antibiotic I'd like to talk about is meropenem. Our brand name is Novapenem. The brand name for the ceftriaxone sulbactam is Novazone SB. Now, for our Novapenem, we have 1 gram and 500 milligram preparations. Also a very powerful beta-lactam antibiotic with a wide range of spectrum of activity against gram-negative aerobes, gram-positive cocci, and anaerobes. Compared to third-generation cephalosporin, it gives very high cumulative fraction rates. So that's how powerful it is. However, with great power comes great responsibility. According to our standard treatment guidelines, it's usually the last line of defense. But so we are encouraged to, as antimicrobial steroids, we are encouraged to respect this in the standard treatment guideline and use it when all else fails, or when pathological data isn't available, to go ahead and use a safer option for the patient. Now, I wouldn't bore you with the indications. There are skin and skin structure infections, community-acquired pneumonia, complicated intra-abdominal infections for the meropenem. Now, as said, our product is made in Ghana, so it's accessible to everyone. It's being produced under the supervision of the Food and Drugs Authority, and it's affordable. Now, the last product I'd like to speak of, it's an Atlantic Life Sciences product known as Levoxin IV. It's levofloxacin IV. The preparation is 500 milligram in 100 ml. Now, for our levofloxacin IV, it has a 60% reduction in mortality when being used for community-acquired pneumonia. And this is better compared to the use of ceftriaxone and clarithromycin in treating community-acquired pneumonia. Now, as said, I won't bore you with the long indications, but there are two main indications you can remember or take home from here. Levofloxacin is used for complicated urinary tract infections and complicated hospital-acquired or community-acquired pneumonia. So yes, essentially those are the three products I wanted to speak on. The ceftriaxone sulbactam known as Novazone SB, the meropenem known as Novapenem, and then the levofloxacin IV known as Levoxin. Thank you very much for your time. And I have a very short message from our CEO I would like to play for everyone to see. Unfortunately, the sound isn't coming, but as you can see, that's our... Okay, so the video was showing us our factory on the Pram Pram Road. I'm sure most of you have seen it. It's the biggest manufacturer of sterile products in West Africa. It was one of the initiatives of the current government for the One District, One Factory project. So yes, that's our production area, as you can see. We are currently in the process of producing vaccines. I'm sure most of you are aware of the shortage of childhood vaccines in Ghana, which was quite a dangerous precedent So to avoid all of that, we started vaccine production in Ghana, all the various childhood vaccines you can think of. We also currently came out with, we've also currently come out with the peritoneal dialysis solutions. Strengths being 1.25, 2.5, and then 4.25. You know, most hospitals are carrying out hemodialysis, and I was told recently dialysis is going to be on insurance. So we thought it wise to give you other options aside from the hemodialysis. Peritoneal dialysis does not require as many equipment as hemodialysis would, and it can be done daily. So thank you very much for your time. I wouldn't want to take too much time. Unfortunately, the video was supposed to continue, but once the audio isn't playing, I think that's so. Thank you once again.
Thank you very much. So they have stands around the hall. So when we are done, you can visit the stands. We'll call upon the registrar, Ms. Yama Kaupuni, to perform a brief.
So to acknowledge the efforts of our academics, we have a citation of honor for them. Professor Banga, please step forward. University of Health and Allied Sciences citation of honor, Professor Kwame Benoit Ngwesan Banga. The University of Health and Allied Sciences presents with great pleasure the citation to you, Professor Kwame B.N. Banga, in recognition of your outstanding leadership and vision that led to the establishment of the ITAM Natural Products Laboratory. This is a testament to your exceptional leadership and project management skills to advance traditional and alternative medicine. Your dedication, expertise, and passion will have a lasting impact on our community. Please accept our sincerest appreciation for your outstanding leadership and contributions to traditional and alternative medicine in Ghana and beyond. Ayuko. Professor Mahamudu Ayamba Ali, please step forward. University of Health and Allied Sciences citation of honor, Professor Mahamudu Ayamba Ali. The University of Health and Allied Sciences presents the citation with great pleasure and admiration to express our deepest appreciation and commendation for your outstanding contributions to the academic community. Your tireless efforts to promote academic excellence through research, collaboration, and innovation have not gone unnoticed. The Uhas Ecl Research Center is a testament to your unwavering commitment to advancing knowledge and improving the human condition. We look forward to seeing the impact of this center on the Uhas community and Ghana at large. Please accept our sincerest appreciation for this achievement. Ayuko.
School of Medicine staff.
Dr. Frank Obeng, please step forward. University of Health and Allied Sciences Citation of Honor, Dr. Frank Obeng. It is our great pleasure to present this citation to you, Dr. Frank Obeng, in recognition of your outstanding contributions to healthcare innovation. Your ICCM Literacy Board game and innovative healthcare app development have demonstrated your exceptional creativity, technical expertise, and commitment to improving health outcomes. By leveraging game design principles and behavioral science, you have created an engaging and effective platform that motivates individuals to adapt healthy behaviors and manage chronic conditions. We are confident that your work will inspire a new generation of healthcare innovators and improve the lives of countless individuals. Please accept our sincerest appreciation for your pioneering work in healthcare innovation. Aiku.
Yeah, just a short word. I think I am humbled by this Prof. VC and Madam Registrar. Thank you very much. But it doesn't go to me, it goes to the team. These are our young doctors. Most of them are products of Uhas. Even Mr. Obed Amenyo, he's a product of Uhas, he's a nurse. All the doctors who are graduating tomorrow, they are all products of Uhas. Aisha and Co, they are all in Uhas. We thank God for this. So you have your little, you can do the lap of honor around the building, okay, and enjoy it. When you are done, then we send it to Pro VC's office. Thank you very much.
All too soon, we've come to the end of this afternoon's program. Tomorrow, 9 a.m. sharp, we'll have the first session of the 9th congregation here in this room. So we are, getting ready to get a room in shape for the event tomorrow. I wouldn't attempt to summarize anything at all, but what is the take-home from here? Take-home is that whether we like it or not, prostate cancer is increasing, the same as breast cancer. My own research over the period, we realized that people report late, and therefore they die. If you report early, you can be cured. And there are several issues about all the other health education areas that our researcher, professor in the making, I think, our researcher and his team are focusing on. We don't want to belabor the point. However, the aspect of co-creation and partnership is very, very important. The fact that they are working with the young people, so we have a future. The fact that they presented at a conference, it means that they understand dissemination. The fact that our regional director also acknowledged the importance of health education in behavioral change and the fact that these will touch lives. I'm also very excited, very, very excited that ECL is not only looking at this center, but looking beyond it to bring to Uhas telemedicine, machine learning, and robotics, which are the core of today's healthcare delivery. And so I am very, very committed to strengthen this relationship to ensure that this happens, because I'm not sure any university is promoting the area of technology in healthcare, and Uhas is one of our core areas, and we want to partner with ECL to make this a reality. FDA, I don't want to belabor the point, they help us to design the place already, and I'm sure they are going to continue to work with us to make it happen. I call this Natural Products Lab Phase 1. This is not my dream for ITAM scientific work. This one is Phase 1. What I see when I close my eyes is a 3 or 4 level building where each floor is dedicated to something unique. Each floor has its own scientific focus, and also a farm, a herbal farm, that the herbalist will not go to the bush looking and a snake will bite you. You go to the herbal farm, you get your herbs, and you do what you have to do. But one step at a time, we will get there. I want to invite Nene. Are you here, Nene? Alfred, where is Alfred? Please come. These 2 young men. Where is the 3rd young man? There's a 4th and a 5th. I call them the 5 young men of ITAM. Some of them have gone to school in China. So, Alfred, come. Come and stand here. These 3, stand here. Hey, why are you shy? These 3, they were 5 young men, are the lifeline of ITAM. They are currently at various stages of their PhD programs, no funding, but they are doing the work and they are struggling through the process. I really want to commend you for the support you have given your director. I always say, together you shine, okay? And it is through your hard work that ITAM is shining today. And I want to encourage you to keep the good work up. One day it will be your turn. So please take your seats. I also want to bring to the stage MES Is it the CEO, director? I'm not sure what the name is. This man has shown Uhas love. That is why the director was emotional. Traveling from Accra to Ho, you can't walk. It doesn't take a peswa from Uhas. And sir, we want to say that, please be here. We want to say that we appreciate you and your team. It's not funny to do things for free, you know. And apart from that, he's also giving someone scholarship. The marriage has started, okay? Uhas appreciates you, not only ITAM. As a university, we appreciate you. Thank you so much, sir. Now, I didn't want to do this, but I want to do it. The head of Farmanova, are you here? Farmanova, please come. Right. When marriages start, they start by a proposal. So I'm coming to make a proposal to Farmanova. Farmanova, this is my first time meeting you. We have a school of pharmacy. Please come here. We have a school of pharmacy, and when I saw the video showed a very, very nice, shall I say, factory or lab. Okay. Our students will come for industrial attachment. And when they come, they need appointment after school, right? Anyway, the School of Pharmacy also needs lab to train the students. When we are going to commission the ECL US lab, a center, it's uncompleted. The lab complex is 10 years old this year. We cannot wait to keep it there, so we are occupying it gradually. So even though the building is not completed, if you help us to do a pharmacy lab, we name it from Farmanova lab. And the proposal is that we want to marry you.
I'm only married.
We want to work with you, and we want to keep you as part of the Uhas story. And we appreciate you for supporting this program. Thank you so much. So on behalf, I know that somebody will give vote of thanks, but personally, I want to thank my 3 men. I know the women will also come, but when you have a vision, you cannot achieve it alone, okay? So when I took office 2 years plus a few months ago, the things I wanted to do, I cannot do it alone. And therefore, we want to appreciate our professors. Professor Banga, okay, so Professor Banga, I'm giving you. And Professor Lee Ayamba, we want to say thank you. And I'm sure others are in the pipeline. But as a university, we are a great giant rising, and we are rising with all the energy thereof. Our council member is here, Dr. Makameho. I didn't see you earlier. Thank you for coming, and we are very grateful that you continue to support us. The medical students who are part of Dr. Albin's team, can I see your hand? That's the 5 of you, right? Or you are more than that? Okay. All right, so we are saying that after all that you do, remember that we still need staff to support us. So as you grow, remember that you have to come back and support the School of Medicine. Thank you very much, and God bless us all.
We invite Mr. Antonio Asempa, Director of Public Affairs, to do some acknowledgements and the vote of thanks.
Thank you very much. We do acknowledge everybody here in gathered. We appreciate your presence and your love for Uhas. Everybody that has to be acknowledged has already been acknowledged, but I'll use this opportunity again to just mention a few. But just know that you are all acknowledged. So again, we acknowledge Dr. Chrysanthus Kubio, Regional Director of Health Service. Then Professor Samuel Atu Duncan, National President, GAFRAM. Mr. Seth Sieneke, Deputy Chief Executive Officer, FDA. Dr. Mark Amaho, our council member. Professor Marcel T. Bayo, you are duly acknowledged. Mr. Felix Boatin, representative from VRCC. You are welcome. Professor T.C. Fletcher, our former Pro-Vice Chancellor. Professor Margaret Japon, the former director for IHR and still working to promote IHR. Professor Benoit Banga, Director ITAM. We have a rep of the ambassador of Cote d'Ivoire to Ghana here. I couldn't get the name. Can we appreciate you? Mr. Linus Ahirpo, Manager MAS Equipment. Miss Sunilda Kujo, ECL. You also have Professor Eric Wood. It's coming. Dr. Teresa Edu, University Librarian. Captain Christian Jenfi, Clinical Health Psychologist, 66 Artillery Regiment. Professor Elvis Takan, Director, International Programs, Uhas. Our sponsors. We appreciate the presence of Enterprise Company Limited, ECL. Once again, you are much appreciated. GAFRAM members, you are so many here. Members of Core Research Manufacturing Limited Company. MAS Equipment Limited. Again. Center Immunotherapeutic Togo. Ghana Medical Herbalist GAM. So I use this opportunity to thank everybody rules in making sure that this program is a success. We give thanks to God Almighty, to all coming from far and near. We thank those who put this program together, the WP staff, and everybody that made this program a success. You are all Thank you all.
Thank you, Mr. Sempa. So after the US anthem, we'll take a few photographs and move to the ECL lab just adjacent this auditorium. From there, we'll move to Dave to complete the ITAM lab. So we'll do the US anthem after that, closing prayer.
Indeed, this is your doing, and it is marvelous in our sight. We want to thank you, Heavenly Father, for being with us from the beginning to the end. The University of Health and Allied Sciences is grateful to you for the addition each day and each new year. Father, we pray, committing the second session of this program into your hands, that you who started with us will continue to be with us and you will end with us. We pray for those who will be traveling back, that Lord, you grant them journey mercies. Just as you brought them here safely, we pray that as they go, your angels will carry them on your eagle wings and take them back safely. We thank you, Lord, and we bless you in Jesus' name. Amen.
We'd like to acknowledge the staff of Diploma University. Can you give us a wave? So please, we'll move to the ECL lab for commissioning, and then there will be buses around to transport those who don't have vehicles to Dave. Please hold on, we'll come down. The dignitaries up will come down, we'll take a group picture. Famanova too still have their stands outside, so you can pass by. Let's get closer and come down the pews. Let's get closer.